For tube thoracostomy, the tube is placed in the mid-axillary line about the fourth intercostal space, which is about nipple level.
After sterile prep and local anesthesia, a vertical incision is made over the fifth rib. Once this incision is made, a Kelly clamp is used to tunnel up above the fourth rib, helping to ensure that we do not injure the neurovascular bundle.
It requires a fair amount of force to enter the chest wall through the connective tissue and muscles. The Kelly clamp is used to apply this pressure in a downward, inward fashion so that the chest wall is pierced. Once it's pierced, separate the Kelly clamp and tear the chest wall open. Care must be taken when inserting the chest tube to insert through the ribs and not into the subcutaneous tissue.
In the case of hemothorax, the chest tube is directed more in a posterior and cephalad direction. In the case of pneumothorax, the tube is directed in a cephalad and anterior direction. Spinning the thoracostomy tube helps ensure that the chest tube is not kinked, and at this point suction can be connected.
To secure the chest tube, a suture is used to close the incision made at the beginning of the procedure. This is tied tight to the chest wall, and then the tail of the suture is used to secure the tube to the chest wall. Care must be taken to do this in a sterile fashion, as this is a sterile procedure. Once the chest tube is secured to the chest wall using suture, it's important to make an airtight seal using Vaseline gauze. 4x4s are used to cushion the chest tube from the chest wall, and then tape is applied.